most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about, should you have a hip replacement surgery? Maybe not.
Right.
We're going to give you some things to ponder.
Right. So, if you've got the arthritis in your hip and you had the x-rays, there's a possibility that you can either prolong it, make it feel better, probably for sure, or, see how things go with the surgery. But is it needed or not?
Yeah, and the first thing is about, we talk about arthritis, Brad. So people assume that arthritis is always going to get progressively worse.
Right.
That's not necessarily the case. And they've done studies on this. At times it can stabilize for many years.
Sure.
And it can also, in some instances, improve.
Sure.
So,
it depends on how you treat it.
Right.
Possibly diet can influence it.
Yep.
There's a number of things.
Anti-inflammatory foods.
Yep. We're going to focus on the exercises on this video.
So number two, the other thing you should consider, have you tried a conservative approach? Have you tried physical therapy? Have you tried the exercises? There's pain meds too. I'm not big on those, but if you need those to get by, then.
Right.
Yeah. There's anti-inflammatory drugs, and
which are across the counter typically.
Yeah.
Ibuprofen, that kind of thing.
And there's shots, of course, but there's also, if you can lose weight, quite
Right.
often there's less stress on the joint.
the
But I
pressure
know
off.
that's difficult. But you definitely want to try a lot of our exercises. That's for sure. The
Right.
stretching and strengthening exercises can make a big difference in the pain. So. Third thing to consider, is it difficult or painful to walk, even with a cane or a walker? If it is, and you haven't tried, and you've tried conservative things, then you're starting to push towards having it done. Because
Sure.
if you're every step you're in pain, you're just making things worse to some extent.
Right. So we understand that their hip replacements need to be done on a certain number of people, but try the options that we're going to
try the conservative options
Right.
first. Now, with the rest of these, we're going to assume that you've tried the options. So, like, if you've done these things and the hip pain is still affecting your sleep,
Sure.
you can't sleep at night, that you're going to wear down fast.
Right.
And other things are going to start giving you problems if you're not getting the
Sure.
right amount of sleep.
I don't know, Bob. Maybe we should mention right now the point is, if you haven't tried them, you can go to our program
Sure.
section. Go ahead. You're
Yeah, I mentioned, go to bobandbrad.com, go to the programs, the heading, and look for hip pain. We got a whole
series.
a series of videos on hip pain, and you can watch the ones that pertain to you.
Right. So if you want to do some conservative exercises specifically, go to the ones on stretching. It'll probably be the best place to start. Strengthening comes after that typically. And it'll zero it in. They're 10 minutes long or roughly. They have a PDF printout, shows a review of the video and the exercises, so you can keep it there and work with those exercises very conveniently. And there's no charge. It's all on.
It's all free.
No email even.
Yep. So number 5, does your hip ache during and after exercise?
Right.
Again, assuming that you've tried these exercises and it's still aching when you're trying them.
Yeah.
It starts hitting the
Especially
wrong
if
way.
it flares it up afterwards, maybe the next day. It either means you did them too hard, which is a good possibility, or if you did them gently and it's still irritating it,
That's a bad sign.
that's a bad sign.
So if it's number 6, if the hip is preventing you from being as active, as mobile as you want to be, which we baby boomers and the next generation, we have high expectations, don't we?
Right. Yeah, we want to continue to get out there and move around and play a little bit.
Yeah. So if it's stopping you from doing that, then you want to consider a hip replacement.
Right.
If your hip stiffens when you're sitting for a prolonged period of time,
Sure.
another sign you might need a hip. Number 8, if you feel grinding, clicking, or popping in the joint, boy, I'll tell you, I'm sure you've had some patients like this, Brad. I've had some where it was like every step, you could hear the grinding.
On the other hand, if it's not, you can hear the popping and grinding, but it's not real severe, and there's no pain
Pain with it.
associated,
Yeah.
that's not all bad.
No, it's not.
So don't get excited. But if you get the popping and grinding and there's
pain along with
particularly
it.
sharp pain, it's, you're going to need to get that addressed quickly.
If you're having difficulty getting out of chairs, especially like the car is pretty easy to so low for a lot of people, that then you're going to have to try to strengthen. If you can't strengthen, you got it. It's starting to look towards hip surgery. If you have difficulty going up and down stairs,
Yep.
There's a lot of stress on the hip when you're doing that, and most of us have to go up and down stairs at some point in our life.
If you go one step at a time,
Yeah.
leading with your good leg, that makes a significant difference. But still, it's not nice to live that way.
Number 11, if you have a decreased ability to bend your hip, cross your legs, you can't do that anymore.
Yeah.
You can't extend your hip. You should definitely do the exercises, but after that, if they still can't, then you may need surgery. If you have trouble getting into the bathtub, which I don't know if that's as you get older, a lot of people don't do baths anymore. They just do showers.
Sit down showers.
Yeah.
And they make the shower.
Handheld.
Yeah.
So,
Gotta
let's see what number on 13. You're tired all the time. Pain is fatiguing.
Sure.
So if you're tired all the time and you attribute it to the hip pain, it definitely can be a cause, and that can lead to depression, anxiety. You know what I mean?
Oh, your spouse or your family members, because when you have pain all the time, your mood changes, and frankly, you just get ornery because of it, and it's a very challenging situation to live in.
Yes, it is. Number 14, you've put on weight because you can't exercise, you can't move,
and then that makes the hip more
worse
stressed,
yet. So, and number 15 does go to mental health, Brad. Like, do you feel sad or hopeless due to the pain? Which if you're an active person and you suddenly become inactive because of your hip pain,
right?
This is a serious thing to consider. Then,
right.
I mean, you want your life back.
Obviously, these are just things to consider. You really need to consult with your doctor, your orthopedic doctor. They're the ones who are looking at it. They're looking at the x-rays. On the other hand, if you really felt uncomfortable with your doctor and they're saying, giving you information, and you don't feel good about the visit, everything is, you can get a second opinion. There's nothing wrong. It can be a really good idea. So you need to feel comfortable with your doctor.
Well, you definitely want to ask your doctor, can we try a conservative approach first? Yeah. Is there some things that we can do conservatively first? And usually with a hip, you can. It's not like it's going to make it worse by holding off.
Sure.
So, all right. Remember, Brad and I can fix just about anything.
Except for
a broken heart.
Right.
But we're working on it.
We do all right with broken hips.
Yeah, that's true.